nowadays. With the blessings of my spiritual guru Aniruddha Bapu and Param Pujya Sardeshmukh Maharaj, I want to share my experiences and findings. I express my wholehearted gratitude towards Bioquantum Academy Canada and Global Scientific Guild for providing me an opportunity to share my experiences and views regarding the cancer. I'll share my screen. Is it visible, sir?
Yes, Dr. Shivani, please continue.
Thank you, sir. Female genital cancer, especially the cervical cancer, is having the high prevalence rate due to the changing lifestyle. The cancers of female genital organs often tend to metastasize. So, there is an urgent need for the prevention and control of the cancer as well as to improve the quality of life. In Ayurveda, Charak Samhita has explained the gynecological disorders in Yoni Vyapa Chikitsa Adhyay. Though the term cancer is not quoted in the text, the similar term symptomatology is explained as a Dushta Vrana, Dushta Pranashotha, Dushta Visarpa, Dushta Granthi, and Dushta Arbud. So, my topic, today's topic is the evaluation of the effect of Krumigna Basti Upakram, that is deworming through enema on the quality of life of a patients having cancer of female genital organs. The Ayurvedic, I want to elaborate some or clear the concepts of some Ayurvedic terminology which you will come across this presentation. First is the Basti Chikisa Panchakarma. What is Panchakarma? The Panchakarma are the 5 procedures for the detoxification of the body, which is quoted in Ayurveda 5000 years ago. And as the previous lecture was with the microbiota, it is proved that the Panchakarma therapy enhances the microbiomes in the body. In Rigveda, ancient Vedic text, Rigveda, as you may all may know about it, there are the 2 types of worms or microorganisms, microbiota. They are quoted in Rigveda. They are called as a Sunama and Durnama name. Their names are Sunama and Durnama. Sunama, the such type of microbiomes which are useful for the body, and Durnama, which are the causing the some diseases in the body. So my topic of this presentation and that my research was taken by the reference of Durnama Yoni Mashe, means there are some worms which causes the ill effects on the yoni, means the internal genital organs of a female. So that with that reference, I have done my PhD in the same topic where there are the female genital cancers which are and the deworming therapy in the cancer which helps in the quality of life of a patient. Considering the worms is one of the risks. Is it the second slide visible? Okay. Considering the worms, that is Krumi, one of the risk factor in the pathogenesis of the vaginal diseases, the deworming enema therapy, we call it as in Ayurveda, Krumigna Basti Upakram, was used in the patients of say, female genital organs. The selection of deworming herbs was known on the basis of the anti-cancer and the deworming activity and properties of the drugs. The rationale behind the project was there is a relation between the worms and genital organs. There is a relation between the uterine diseases and Vata dosha, as it is quoted in Ayurveda, Nahi Vata Drutyaryonir Narinam Sampradushyati Shamaitvatamannasya Kuryat Doshasya Bheshasham. And the best treatment for the vitiation of a vata, which is a causative factor of all genital disorders in female, that is a vata dosh. The best remedy for the vata dosh is the basti chikitsa, that is the enema therapy. So let us discuss about the etiology of the diseases. I'm sorry, this is a very little letters. Font is very less because of the much information incorporated in, but I will tell you in a short. There are the external causes, external factors, that is Ananta's food and the food habits. Also, some other habits which are not related with the food, then polluted food, bad eating habits, worms, and the destiny are the external factors which are the causative agents of the cancers of female genital organs. The internal causes for the female genital cancer, as quoted in Ayurveda, is the vitiation of the ovum, vitiation of the menstrual cycle, and vitiation of the vata dosha in the body. The mentioned factors are responsible for the vata, pitta, and kapha tridosha vitiation, which results in the vitiation of apana vayu, which is the main energy factor of a body, and the ovum vitiation. The vitiated pitta dosha leads to the vitiation of blood, semen, muscles, while the vitiation kapha dosha leads to the channels and the fluid in the body, muscles in the boys as well as in the girls, and the semen vitiation. This all vitiation ultimately leads to the production of the unwanted watery content in the body. We call it as clade, which is a positive organism for the worms. On the other side, vitiated pitta dosha leads to the muscle weakness. Ultimately, it facilitates the production of the blood-borne worms in the body. So both blood-borne worms and the vitiated kapha worms are the having their local constitution, and vitiation, they vitiate the female genital organ like with uterine cancer and ovum related abnormalities. So to assess the things, my project is the evaluation of the effect of Cromigna Basti Upakram, that is deworming enema therapy, on the quality of life of cancer patients of female genital organs. So, to assess the effect of Cromigna Basti Upakram, that is deworming therapy, signs and symptoms of a cancer were taken in the consideration. Then the signs and symptoms of the worm infestation, then the quality of life and the well-being in the respect of Karnofsky score was taken the consideration. The inclusion criteria, materials and methods, all the literature studies, Ayurvedic texts, Sanskrit dictionaries, some book and articles from the modern medical systems of medicine, and related sources of authentic websites were considered. And for the clinical work, I have taken the patients suffering from cervical, vaginal, ovarian, endometrial cancer of all stages and all grades. The inclusion criteria is the known diagnosed cases of cancers of organs of female genital system, that is ovarian cancer, uterine cancer, vaginal cancer, cervical cancer of all stages, stages 1 to 4 and grades 1 to 3, including the both the study and control group. The patients between 21 years to 80 years were incorporated in the group. The exclusion criteria, the pregnant ladies and lactating females were excluded. The age below 21 years and above 80 years were excluded, and patients undergoing the chemo and radiation were excluded from the treatment of panchakarma therapy. And the patients who are having the major illness like cardiac disorders and fever, they were excluded from the group. Total 184 cancer patients of female genital organs were examined. Among them, 70 patients undergoing Shamana Chikitsa, that is the medicinal internal medication, were selected on the basis of the inclusion criteria. And these 70 patients eligible for the enema therapy having identical stage, grade, and conventional treatment and the duration of Ayurvedic treatment were randomly enrolled in a study and the control group. The internal medication which was given to the patient was Chandraprabhavati and Pravalpishtivati with a 500 milligram dosage twice a day, and after before lunch in the morning and the evening, and after lunch and dinner Arogyavardhinivati and Triphala Gugul, which are more working on the liver functioning and the fire of the disease. They were given to the patients. The actual regime is the enema therapy, which was tried in the group of study group. There, the enema therapy, we use the medicated oil and decoction in the form of Matra Basti and Niruha Basti, and it is given in the alternate phase, that is one oil enema followed by one decoction enema. So for the oil enema, there was the three medicines were used which are having the deworming activity as well as the anti-cancer activity, which is proven previously. Then neem tel, then which is Azadirachta indica oil, then Nirgundi, that is Vitex nigundo, and Milicia pinnata, that is Karanja oil, in the quantity of 20 ml, 20 ml, and 10 ml was given on the first 3 days rectally per rectal route, and followed by Embolica rice, Cyprus rotundus, Phyllanthus embolica, Terminalia cebula, Terminalia bellivica, Baliosperma momentum decoction in the with the ingredients of rock salt, honey, and barley were incorporated as a decoction, and it was given in the round about 500 ml on the 4th and the 6th day of a treatment regime. This was given for the study group of the patients. Now, the clinical assessment criteria were classified on the basis of major two criteria: the symptoms of female genital cancer and the worm infestation, symptoms related to worm infestations. All these symptoms were graded according to the common terminology criteria of adverse event guidelines, that is CTCAE guidelines. The symptoms which were assessed in the clinically were per vaginal discharge, vaginal burning, vaginal itching, abdominal pain, backache, fatigue, and weight loss. The grading of the symptoms were done according to CTCAE guidelines, as grade 1, 2, 3, 4 accordingly. All these symptoms were graded with a universally accepted gradations. The assessment criteria for the worm infestations were taken the consideration is the discoloration of a body, pain, body ache, vertigo, anorexia, and diarrhea, which are the symptoms quoted in a Ayurvedic texts. So these gradations also were carried and graded according to CTCAE guidelines. Now, hereafter, assessment criteria was, second assessment criteria was EORTC QLQ guidelines. That is a European Organization for Research and Treatment of Cancer Quality of Life questionnaire, is an integrated system for assessing the quality of life of cancer patients participating in the clinical trials and other types of research in which the patient reported outcome is calculated is collected. So that QLQC30 was taken in the consideration. This is a form of QLQC30. I am sorry, because of the very less font, it is not much visible. The third assessment criteria was the Karnofsky score. The general well-being and the daily routine activities were calculated in patient's point of view. Ascending order shows the improvement in the well-being of the patient. The assessment score was as per the formula described by Brook et al. So this is a criteria of Karnofsky score from 100 to 0, where the number 100 shows the good well-being and the 0 is the patient is the deteriorating. Now, with the biochemical examinations, these patients were undergone hemogram, HbCbC-ASR, liver function test, renal function test, C-reactive protein, CA125, that is tumor marker for ovarian cancer, and stool examination was done to assess the worm infestation in the stool or whether there is a worm infestation or not. Now let us go for the demographic analysis. Each study and control group age having the age between the 51 to 60 years, which was the menopausal age, having high score of diagnosing the cancer. It was observed that a study and control group was from the medial socioeconomic status of ovarian and uterine cancer patients were the more. The patients of cervical cancer and vaginal cancers were equally distributed in both the study and control group as 11 and 2 in number. 7 and 8 patients of uterine cancer are recruited in the study and control group respectively, and 15 and 14 patients of ovarian cancer are recruited in the study respectively. The similar number of each stages of patient in study and control group as the aggressiveness of the cancer and treatment response depends on the stage of cancer. The aggressiveness of cancer can be more precisely explained on the basis of the grading of a cancer. Equal number of patients in both study and control group helped me to assess the response of Ayurvedic treatment on the equally distributed cohort in both study and control group. The disease status, quality of life, and progression of cancer patient mainly depends upon the conventional treatment taken by the patients. Considering their post-conventional treatment, similar number of patients were added in both study and control group. The maintained and increased Karnofsky score in all study group of patients at both times, point B and point C, indicates the effective of Karnofsky Kremigna-Basti Upakram, that is deworming therapy, and the well-being of the patient suffering from the gynecological cancers. The functional score at the time point B was extremely significant and significant at the time point C. The scores, symptom scores were significant at time point B and very significant in the time point C. The global score is significant at time point C. High functional score represents the high healthy status of a life. The high symptom score represents the high symptomatology. The high global score represents the healthy status and high quality of life. There is no significant change in the weight at the time point B and C in all patients. The clinical data analysis shows the effective of Krumigna-Basti on per vaginal discharge and vaginal burning and, excuse me, next slide. Per vaginal discharge, vaginal burning and vaginal itching. The study group patient shows the significant result in the abdominal pain at time point B and C, and statistically results were found in the backache and fatigue. The Basti Upakram enema therapy is found to be very effective in fatigue. For the symptoms of krumi, that is worms, were statistically significant in shula, that is pain in the abdomen, fatigue and vertigo. They were very effective in time point B and C, but it was not significant in a control group. The results of this data supports that the deworming therapy in the cancer patient is beneficial in the symptoms of cancers, symptoms and as well as the symptoms of the worm infestation, and it enhances the quality of life. In biochemical analysis, significant improvement is observed in hemogram. The enema therapy is associated with the elimination of the toxins from the GI tract and improvement of the digestion and absorption of the nutrients as a consequence of this treatment. WBC remained the same, but platelets also remained the same, but RFT and LFT were having the same results. Extremely significant result was obtained in C-reactive protein, which is an inflammatory marker in all types of cancer. And this is the basic underlying cause of most of the malignant changes in the body. There is a significant result of CA125 in the ovarian cancer patients, which is indicative of effectiveness of the enema therapy for the disease progression. The significant reduction in the ova in the stool is obtained after the treatment of enema therapy obtained in the stool, and with it indicates that there is a complete elimination of the intestinal ova and the ova related to the lower part of the rectum. They were completely evacuated from the body. This is the intra-group analysis, and this is the intergroup analysis. It's a very small font because of the lot of data is incorporated in this. So the conclusion is the clinical evaluation. This remedy is highly effective in the symptoms of a cancer as vaginal discharge, itching and burning and body ache, and along with the symptoms of worm infestation. The quality of life is notably improved with the improvement of the well-being and reduction of cancers related symptomatology, which is reflected in functional, global and symptom scores of QLQ C30. Karnofsky score measuring well-being and the quality of life cancer patient is used to assess the treatment. In study, maintained and increased Karnofsky score indicates the effective of the Crimigna Basti Upakram, that is deworming enema therapy, on the well-being of patients who are suffering from female genital cancers. This treatment shows the significant effectiveness in the biochemical analysis also. So, this action helps to control the cancer progression as per the Ayurvedic principles. What such type of drugs which I used to get the enema therapy done, I want to elaborate the herbs and their functions. The deworming property of Azadirachta indica, Vitex nigundi, Pongamita pinnata, Embellia ribes, Cyprus rotundus, Terminalia bellerica, Terminalia cebula, Phyllanthus embellica, Moringa oleifera, and Valiospermum montamum are mentioned in the Bhava Prakash Nigantu, that is the text of Ayurveda, one of the texts of Ayurveda. Additionally, Pongemia pinnata, Moringa oleifera, and Baliosperma momentum, that is, are quoted as a yoni dushtikar. That means it are beneficial for the female genital organs. The Kledanashak property of, that is, eradication of the excess fluid in the body has the property of Triphala, that is Haritaki, Bibhitaki, and Amalaki, Terminalia chebula, Terminalia embolica, and Terminalia bellerica. They remove the excess amount of water which is not required in the body. So that helps the vitiation, that will helps to remove the constitution which is required for the growth of the worms, and cancer manifests when the shoth, that is inflammation, and the ulcers are there. So these three products, Terminalia chebula, Terminalia bellerica, and Phyllanthus embolica, these three products, that is collectively, are having the anti-inflammatory and anti-ulcer activity which is found in our research. The medicines such as neem, which is used in Matra Basti, then honey, we are used in the Matra Basti, in the Niruha Basti, that is a decoction enema, which facilitates the medicine to uh, go to the deeper penetration or action, along with the, it acts as a vehicle for the medicine. Pervaginal discharge was the common presentation in the female genital cancers, and this persists till the conventional line of treatment was there, but it vanished completely with the treatment of the enema therapy. The color, consistency, temperature, quantity, and the smell were significantly changed with the help of the enema therapy. This enema therapy is extremely significant in the cancer patients of female genital organs. I have, when I was treating such type of patients, among these 70 patients, one patient who is having the uh, onset of cancer at the age of 46 years is still living up to the age of 76 years, carrying female genital cancer, but living her daily routine activities as a normal patient. Is such patients are the achievement of Ayurvedic principles, and it's a conquer among the symptomatology. We cannot say that the cancer is completely treated by Ayurveda, but there are some concepts which are closely related to the symptomatology and etiology of cancer. On that basis, when you treat the patients of cancer, definitely they can have a better life. We are not going to say that cancer is completely cured with Ayurveda, but the quality of life of a patient is definitely improved uh, and better than the modern medicine as we find in the day-to-day practice. Now I'm regularly seeing the patients of cancer which are having a different types of cancer, that is hepatocellular carcinoma, the cancer of a retina, cancer of this female genital organs, even the sarcoma. There are different types of patients which are coming across to me, and with the basic principles of Ayurveda, we are trying to give the relief in the symptoms, as well as we are trying to get the best immunomodulation in those patients having the Sukshma Aushadhi Chikitsa, that is a nano technology of Ayurveda. We call it as a Tirtha Aushadhi or Sukshma Aushadhi Chikitsa for the betterment of the cancer patients. We don't know the end day of any patient, but we can expect that whatever days they are remain with that patient, whatever life they are having, we can give the uh, better life, better quality of life with the help of Ayurveda. Thank you very much.